presentation. I'll just introduce myself. I'm Sarina Corsi. I'm a senior consultant at the BC Carry Registry, and in my role at the Registry, I provide leadership to education assessment initiatives. And I'll just let me just put this down. So, looking at opportunities for innovation and flexibility with you today. This is myself and my role at the Registry. Just want to quickly overview the role and the mandate of the Registry. We were established in 2010 by the Ministry of Health with a primary role of protecting vulnerable patients, clients, and residents, and having a mechanism to report abuse, to report abuse and to investigate reported abuse. The second mandate is to establish and improve standards of care. And that's what my focus is going to be on today, looking at improvements to standards and where standards have been established, where they didn't exist previously. And then, of course, to promote professional development is the third mandate. So identifying potential solutions to address system-level challenges and identifying opportunities for the sector to make more effective use of the current workforce of healthcare workers. So in preparing for today, I was reflecting on what I might speak about, and I know we've touched a little bit on literature and poetry, so art is coming now. So this painting from Paul Gauguin, painted over 100 years ago, Where Do We Come From, What Are We, and Where Are We Going? Is read from right to left and represents the cycle of life from birth to older adulthood. A painting of personal significance to me, having a family in Boston. The museum's housed at the Museum of Fine Arts in Boston. I went with my grandmother as a child growing up, and then as an adult during graduate work in Boston, visited the museum as an adult. This painting gives us a context as well to think about where we've come from, and in looking at the key questions, where are we now and where are we going? So it's important to get the context of looking back, as well as really understanding where we are now, and then what the foundation is for looking ahead. So in looking back, I'm not sure how many of you are familiar with articulation, with the articulation committees. See a few nods in the audience. Articulation is run through the BC Centre for BC Council for Articulation and Transfer, and public post-secondary institutions there are meetings of educational institutions. All different stakeholders come to the first day of articulation to discuss areas, education and workforce trends, and it provides a wealth of information. Minutes are posted on the articulation website for BC CAT. So I went to some of the minutes to see where have we come from and get a better understanding. So looking back to 2005, what was happening in the sector, inadequate training and concerns, and these are quotes directly from minutes that are posted. English language skills was a major area where there weren't sufficient expectations being set, and supervisors were having to reteach essential skills. And at that time, as today, we saw that facilities were struggling for staff and the industry is in crisis. Graduates aren't applying for home support. So a lot of the same themes that we're hearing today were present in 10, 15 years ago. Graduates needing to meet the same criteria. So there was real inconsistency in training that was being provided in the sector. And then the age-old question, the question we're asking today is, how do we increase the image, the profile of the home support resident care attendant worker so that it's viewed as an attractive career option? So this was a question that was being asked actively by multiple stakeholders at articulation in 2005. And the same themes and conversations continue through 2006, 2007, 2008. Issues with not enough workers, complexity of care is increasing, recruitment is at a crisis situation, language concerns were paramount. And there was frustration as well because the health authorities were in a position of having to evaluate the programs and who was going to mandate use of the provincial curriculum. So looking back, there was an insufficient supply of HCAs, particularly in home support, a lack of consistency in training, and issues in terms of English language competency. And then we've referred to it today, the BC Cares campaign in 2008-2009. We'll call it was a boost to enrollment that happened, and actually with adding 5,000 new beds to the sector, and over 1,000 new HCAs were trained in this time period. So the great effects of that initiative were felt for many years subsequent. But the schools as well at that time couldn't find clinical instructors. It was a real challenge for the schools. It's something to note. There was challenges as well as great solutions too. So just to note that the recognition process got started alongside the formation of the registry. There was a standards committee that was struck to really look at this area of inconsistent training. And in the recognition process, we look at programs to make sure that they're compliant in a number of key areas, that they have adequate facilities for training and labs, that their instructors are qualified, that students are appropriately admitted, that the curriculum meets the provincial curriculum requirements, and that they're listening to stakeholders, talking to employers, is the program meeting their needs, and making improvements where needed. So we have this process in place. There are 38 educational institutions in BC that are recognized, both private and public, and they've been confirmed as meeting the standards. And so on our website we list the programs and their recognition status, and I encourage you to go to our website and check. It's exciting to see. I do want to mention that we utilize, it's not just graduates. So the registry, we have over 34,000 active registrants in good standing, which actually is interesting because we have a great resource for understanding our workforce. That it wasn't its primary mandate to give us information about workforce planning, but we know how many are registered, we know how many are registering from in different areas as well. So we have approximately, the largest category is HCA grads, 2,300 a year from both the private and the public educators, about 1,100 approximately from each per year. And in terms of quality oversight, they're assessed by the registry as meeting provincial standards. The second largest category, so utilizing the knowledge and the skills of nursing students, registering nursing students after they've completed sufficient training, as well as allowing nurses, licensed LPNs, RNs, and RPNs to join the registry, and they can work as well. So that's our second largest quadrant. And there's quality assurance for them through the Canadian Nurse Regulator approval. Okay. The third, the next area, there's two other registering categories: internationally educated healthcare professionals, about 350 a year come onto the registry from that area, as well as graduates from programs outside of BC. And so in terms of the oversight for those categories, those applicant categories, the training will vary. For international, some internationally educated nurses have never worked in the role of the HCA. They've never provided the kind of care that an HCA provides. So it's important to assess where they're at and make sure they're safe and competent before they are registered. And the same with graduates from programs in Canada. The same issues that were happening in 2005 in BC are happening across the country. And we know that because we speak to we speak to those that are leaders in this area across Canada. So NCAS is the pathway for internationals, and just recently we've changed the requirements, improved the standards for the Canada grads to go through NCAS. And we do it in collaboration with the BC nursing regulators. NCAS evaluates their skills and pinpoints, identifies any areas where they do need to remediate so they can be safe and effective care providers. I'll just pause here. Oh, there we go. So post NCAPS, what I really wanted to highlight is that approximately 80% are remediating in a streamlined way. Okay, so I wish we were able to direct register every single internationally educated nurse that applied to the registry. But they do need some additional upgrading, and so we've worked with educational institutions to make pathways available. It can vary from a short module to a short program. The HCA upgrade being the newest innovation in terms of a program. It's about a third of the length of the full program, and it's quite effective in ensuring they're safe and effective by providing a comprehensive theory review, lab, and then practice consolidation. So it's essential to provide these education remediation options to this group so that they can become registered and safe. So in just looking at the future and opportunities for innovation and flexibility, I didn't really get talk too much about this, but programs are starting more and more to deliver their programs in part-time and weekend formats, using online and video conference formats, especially to deliver the training in remote and rural communities. I think further ESL support and even online ESL can be a strategy to supporting people in improving their language skills, partnership with immigrant organizations, and certainly program partnerships with employers. We've heard about some collaborations like that today. And then looking at financial support for education upgrading for candidates, especially internationally educated candidates, where it may just be a $200 bursary that will get them that course, but that they can then register and become registered carriers that can be added to that can enhance our workforce. So we're looking ahead. We're in a great position in BC. We really should celebrate where we're at. I mean, the education, the consistency and training that we have is remarkable. We have a very workable level of language competency now for those that are graduating from programs. Graduate outcomes have been improved, and we have an excellent competency assessment process for those from other jurisdictions, and I think there's great potential for collaboration and partnerships.